If you have hand osteoarthritis, chances are your finger is not feeling the greatest. Somewhere in one of these knuckles, maybe even your thumb, and using a splint like one of these right here could save the day for you and get that inflammation down. So I'm just going to tell you a little bit about these splints and the differences between them and show you how to use them so that you can get your hand arthritis under control and hopefully begin to reverse the problem so that you can live your life and do what you want to do. This kit right here is all different sizes. It came in this box, kind of just a normal looking box, brown box. And they're different sizes. You can see these are about the same size, and then you have some smaller ones. And here's how you would use them. This one is going to go on like a pointer finger or middle finger, one of your longer fingers. It's got these Velcro straps, and you would just slide that on. It's got nice, comfortable foam. The metal's bendable, so you can open it up like that, fit your finger in there, clamp it down, but it won't stay very well, so that's why you need the straps to cinch it down on yourself. And you'll just snugly put that on, just like that. And then what you're doing here is that finger is not going to bend. So if you try to close your hand, that's as much as I can close it right there. And you want to wear something like this if this joint or this joint is bothering you with hand arthritis. Because if you can fix the joint, in other words, if you can keep it from moving and you're not using it as much as you are your other ones, despite you having to keep up your normal daily activities, you know, you go grab things, you go put things away in the house, and you're putting on your clothes, you're cooking a meal, you're taking care of chores around the house, and you just inevitably use your fingers. But this is going to prevent the joints in the finger that you're trying to help from being worked too much, so you're not aggravating it more. So that way you can get your pain from a 8, 9, 10 down to a 5 or 6, or maybe even under a 3. That would be fantastic, because then you can start to do exercises that are going to fix the root problem rather than just survive and try to mitigate the pain all the time, because that's possible. I'll tell you more about that in a second. One thing about these is you can wear them sideways, because sometimes people will have nodes, is what they call them, where the knuckles thicken. You'll have a proximal node or a distal node, or they'll call this a PIP node or a DIP node. The PIP and DIP just is the way we term these in medical term, which knuckle we're talking about. But if your fingers are kind of starting to, if your joints out here are starting to bend sideways, you don't have to just wear them like this. You can turn this and wear it like that to try to straighten out your finger if it's going crooked. Now, depending on how crooked your finger is, you might not be able to fit that brace on very well, but it is an option. You'll have to check out and see if that's something that you can do to kind of straighten it out. It doesn't mean it's going to straighten it all the way. You're just trying to prevent it from getting worse if your finger's just deviating off to the side. These braces obviously are metal on the outside with foam on the inside, and they got these white straps. So, you know, they're kind of cool looking in my opinion, that shiny metallic blue. But you have these braces out here that are all black. They come in this box here, Vive finger splints, and you get a pair of them. And some people might just prefer the way these look. They do have a different setup. So they're this nylon material, really squishy, really soft. And then in this part right here, they have like a fixed piece. I don't know if it's a metal or a hard plastic, but that doesn't bend. That doesn't give there at all. Let me use this one since it doesn't have a little tag attached to it. So this one is just a one-sided splint versus this is a two-sided splint. So there's a little more versatility in this. You might just use this on the bottom part of your fingers to prevent it from bending, like that. You can put it on any finger, obviously. You can put it on your pinky. This is a one-size-fits-all situation here, so you'll have to manage that. If you don't like blue or you don't like the metal, this might work for you so you're not banging on something versus, something like this. If you're dealing with glass like this table is or metal, then you might not want to scratch up surfaces. You might even have both, just for the situations that you're in day to day, and you can adapt to the situation that fits best for you. So then you can also turn this to the side again for those crooked fingers. If you want to try to straighten it out or at least keep it from getting any worse, you can put it around that joint that's bothering you. So if it's this joint that's getting crooked, you can lower it there and cinch it down there. Or if it's a little farther up on the fingertip, you can cinch it down on that side to block it from going sideways. Or you can twist it around if you needed to block it from going this way and you're trying to straighten it out that way. So I like these finger splints overall for people with hand arthritis, just especially if you're trying to get the symptoms down. Because if you're phase 1, which is something I talk about in the hand arthritis recovery program, you can check out a link for that in the description. If you're in phase 1, your fingers are just swollen and irritated, and it's painful to grab things. You're just having trouble doing your everyday life. And using a splint like these is going to help out a lot to allow you to still do things while calming down the joint in your fingers and your thumb so that you're not going to aggravate things. If you want to learn more about exercises and things you can do to fix the root problem of hand arthritis, check out this video right here. It's called The #1 Way to Help Hand Arthritis Improve for the Long Term.